The France Foundation implemented 25 grand rounds over the last year, scheduled across the country at locations where NTM prevalence is high. In addition to the grand rounds, the content was recorded for enduring education. The content for both was developed by Doctors David Griffith, Theodore Maris, and Kevin Winthrop. Activities used case-based content to highlight examples of Mycobacterium avium and Mycobacterium abscessus lung disease. The education was designed to be highly engaging and interactive, with less focus on didactic lecture. Speakers were trained by a professional speaker trainer on ways to create an interactive and experiential session, specifically with this content. Additionally, participants in the grand rounds were encouraged to view a pre-learning whiteboard video prior to the lecture as a refresher on NTM disease state, classification, and epidemiology. Combined, these two efforts allowed for the majority of the time during the grand rounds to be spent discussing case scenarios. Learners had the unique opportunity to really engage with the NTM expert as they asked and answered questions about the cases, discussed treatment options and guidelines, and reflected on their own practice. Instead of a typical lecture, attendees were able to actively participate in their learning. Speakers described this structure as fun and well-organized, and learners self-reported significant gains in confidence managing patients with NTM as a result. The impact of the grand rounds was very positive overall, demonstrated by 91% of learners indicating they are planning or considering changes following the education. As described by one meeting host, the presentation was comprehensive and provided a great review of the literature, as well as many take-home points that were very relevant for our residents, other physicians, and providers present. I think we all have a much better understanding of MAC now. In addition to the live learning, clinicians were able to access the same content online through 3 interactive case modules. Again, learners were given the opportunity to engage with each case and answer questions regarding treatment decisions and best practices. Providing the online format allows for those more self-directed and independent to access the education while still engaging in a participatory manner. Combined, this initiative reached a total of 1,864 learners, primarily physicians, who collectively see an estimated 9,293 patients with NTM each week, making the reach of this education significant, especially in areas of the country where NTM prevalence is high and the need for education is great. Primary care physicians self-reported the biggest gains in ability, knowledge, and confidence, though this group also had the lowest baseline knowledge, indicating a particular need for education among this group. For both live and online learners, confidence managing patients with NTM was identified as an important area for improvement through future case-based educational activities. The France Foundation would like to thank INSMED for their educational support that made this activity series possible.